The basic function that a spinal cord performs is basically just providing a conduit to carry the messages towards the higher centers in the brain, and then obviously the interpretation, and then these messages are sent back to the effector organs through the tracts that are present inside the spinal cord. So these tracts are basically the communication pathways that are present between the effector organs and the higher centers that are being located in the brain. So the spinal tracts mainly can be divided upon the function that they're performing, either carrying the sensations or either they're sending back the messages or commands from the higher centers of the brain. So depending upon the function that they perform, they can be divided into either the sensory and the ascending afferent pathways. So the pathways or the communications or the tracts that are taking the sensations from the peripheral organs towards the brain, they're called as the afferent pathways. And on the other hand, the motor and the descending pathways are known as the efferent pathways. So they can be mainly divided into two different categories out there. Mainly the motor and the descending tracts are being divided into the pyramidal tracts. We have namely the lateral corticospinal tract or the anterior corticospinal tract, and the extrapyramidal tract encompasses the rubrospinal, reticulospinal, olivospinal, and vestibulospinal tracts. Now, their exact localization or organization starting from laterally and moving on towards the medial aspects. So the lateral corticospinal tracts, as the name is indicating, they're going to be present laterally. And then we have the anterior corticospinal tracts as mentioned over here. The extrapyramidal tracts are basically located over here, specifically the rubrospinal tract. Then we have the olivospinal tract, and then mainly we have the vestibulospinal tract that is located slightly laterally. So this is the exact location when we observe a cut section of the spinal cord, how the motor and the descending afferent pathways can be identified. So these are mainly the vestibulospinal tract, the olivospinal, reticulospinal, and the rubrospinal tract. Moving on, we have the sensory and the ascending afferent pathways. So mainly we have the dorsal median column or lemniscus, and then we have the medial lemniscus system. This lemniscus system is basically being compromised of the gracile fasciculus or the cuneate fasciculus, also known as the fasciculus gracilis and fasciculus cuneatus. And then furthermore, the classification goes on like we have the spinocerebellar tracts, mainly the posterior and the anterior spinocerebellar tract. The anterolateral system divided into a lateral spinothalamic tract and the anterior spinothalamic tract. So this is the exact localization of a gracile fasciculus and a cuneate fasciculus, which is lying a bit laterally to the gracile one. Then we have the spinocerebellar tracts. One is posteriorly located and the other one is anteriorly located. And then we have the laterally located spinothalamic tract, and finally we have the anteriorly located spinothalamic tract. We have to keep in mind that the function that these tracts are performing are basically carrying the sensation towards the higher centers of the brain. And most anteriorly, we have the spino-olivary fibers that are present most anteriorly, even anteriorly to the anterior spinothalamic tract. So the basic functions that all of these tracts perform are to basically carry out the messages from the peripheral organs and towards the higher centers of the brain. And on the other hand, the motor and the descending tracts are present that are basically carrying the sensations back to the effector organs, and then they have to obey the commands accordingly.